Europe is grappling with a second wave of COVID-19 infections. Governments are racing against time to impose tighter restrictions. But these moves might be a little too late. Two of Europe's biggest capitals are currently facing the wrath of the virus, with Paris imposing overnight curfews and London considering banning people from meeting indoors to combat the spread of the disease. The World Health Organization's European office has now said that the rising surge in cases is a cause of great concern.
The fall-winter surge continues to unfold in Europe, with exponential increases in daily cases and matching percentage increases in daily deaths. The evolving epidemiological situation in Europe raises great concern.
Earlier, French President Emmanuel Macron announced that 9 regions, including Paris, will have a curfew starting from Saturday. The curfew will impact around 18 million French citizens. The state of health emergency for the country has also been reinstated. Residents of these 9 cities would not be allowed to be outdoors between 9 p.m. and 6 a.m. from Saturday for a duration of at least 4 weeks. The new measures are aimed at stopping people from visiting restaurants and private homes in the late evening and night hours. London will enter a tighter COVID-19 lockdown from midnight on Friday as Prime Minister Boris Johnson seeks to tackle a swiftly accelerating second COVID-19 wave. Anger is also on the rise over the economic, social and health costs of the biggest curtailment of freedoms since in decades.
Take firm and balanced decisions to keep this virus under control. This is the only way to protect lives and livelihoods. And we must act now. Delayed action means more deaths from COVID, it means more non-COVID deaths, and it means more economic pain later, because the virus comes down slower than it goes up. We should stop it going up in the first place. And unless we suppress the virus, we cannot return to the economy we've had. Unless we suppress the virus, we cannot keep non-COVID NHS services going. And unless we suppress the virus, we cannot keep the elderly and the vulnerable safe and secure.
In Spain, Health Minister Salvador Illa said the COVID-19 situation was very worrying, with the COVID-19 patients occupying 20% of the hospital's capacity in Madrid. Since Spain exited a tough lockdown in June, the infection rate has increased, with daily cases exceeding 10,000 from late August. Hospitalizations are on the rise as well, but the number of severe cases remains far lower as compared to the first wave. On to Germany. Chancellor Angela Merkel has said that she and the leaders of Germany's 16 states have agreed on tougher measures. Limits will be imposed on the number of people at private events if an area records more than 35 new infections per 100,000 people over 7 days. Even more stringent caps will be put in place if this number exceeds 50. Europe's biggest economy will also begin imposing mandatory mask wearing at crowded places. The Netherlands, which got away with some of Europe's laxest regulations, is also going into a semi-lockdown of sorts, its strictest measure since the month of March. All pubs and restaurants have been ordered to remain shut, but unlike the first lockdown, schools and public transport will continue to function. The measures will last for 4 weeks, with a review scheduled after 2. The Netherlands has the highest per capita infection rate anywhere in the world, reporting a daily caseload record of over 7,000. Joining us for more on all of that is our correspondent Stuart Smith, live from London. Hi Stuart, the anger is palpable on the streets of London. Will these new measures cause further confusion? We've seen a series of regular changes in the rules over the last few days.
We certainly have, and regular indeed. It's changing almost daily depending on which part of the country you're living in. The UK government is going for a new strategy which is a series of tiered restrictions. So there are 3 levels of restrictions, and depending on the rate of infection in your particular local area, you will have to obey different restrictions. And as you said, London is now entering this scheme. It's going into the high level, which is a medium tier restriction, level 2. But the north of England, for months, has seen much higher rates of infection than London, and they've been under restrictions for many months, much stricter than even what London's about to go into. And that's annoying a lot of the mayors and city leaders in the north of England. They're saying, why are these restrictions only now being taken seriously when we've been having these high rates of infection for a long time? But there's another part to this. The mayor of Manchester does not want stricter restrictions. Those level 3, the last most extreme level of restrictions, could be on the cards for his region. But he's not happy with the level of support coming from the government. He says that if Manchester were to go into lockdown and under those level 3 restrictions, the economy would implode. It would not be able to sustain itself in Manchester. On the other hand, you have Sadiq Khan, the mayor of London, who wants tighter restrictions. So the government has this really difficult balancing act to make, with many people across the country all with different ideas about what the UK government should be doing and how it should be doing it.
Right. What have the experts been saying is the primary reason for this second wave of COVID-19 infections across Europe? Are the weather patterns the only possible reason at this point? And even though the numbers are worrying, most countries have been shying away from extremely harsh measures, fearing the economic impact.
Yes, like you said, it is surprising that the Netherlands is one of the few countries in Europe to actually have imposed a national lockdown. Most countries in Europe are trying to avoid that. Angela Merkel saying on Wednesday that there is a balance to be made between the health of the economy and the health of the nation. It's a struggle for these national leaders as to what to do. And indeed, it is quite serious here in Europe. A statistic today came out showing that the infection rate in European countries is now higher than the United States per day per million people. So Europe now overtaking the United States there, but indeed not seeing the same level of restrictions that happened in spring. A lot of disagreement within countries about what to do because of this, not just between countries, and we're certainly seeing a very fragmented view across Europe, many different ideas about what should be done, many different approaches to trying to combat this second wave.
All right, thanks very much, Stuart, for all of those updates.